Hi, everybody. I'm Pamela D Wilson, caregiving expert, advocate, and speaker. We are in the home stretch of creating a plan for loved ones with memory loss. The section called Steps to Being Proactive. This one is all about you. It's all about the importance of patient and caregiver education. As always, we're going to quickly go to my housekeeping tasks that you have heard probably 3 or 4 times by now. Want to go through them quickly, and then we will start the program. Let me advance the slide and take myself off camera. So you know the drill, housekeeping. I use the term elderly parent, and parents substitute that with the person that you take care of. The outline for this module is in the course if you haven't checked it out. Print the slide handouts if you don't know that by now. If you don't have them printed out, stop this webinar right now, print them out and come back. The ellipses, dots in the slides, I put them in there on purpose so that you can follow along with me. Let's talk about the objectives for patient and caregiver education. At the end of patient and caregiver education, you should be able to demonstrate the actions that caregivers and elderly parents with dementia can take to advocate for medical care in a care system, believe it or not, that is not always sensitive to the needs of middle-aged and older adults. Let's talk about medical responsibility and advocacy and ongoing medical care and medications. For this discussion, I'm going to assume that you are the medical power of attorney because I want to talk very seriously about responsibilities. If you're a caregiver, you can still have a similar responsibility, but you don't have that legal ability to act. If you're appointed as a guardian or a conservator already, which is the term depending on which state you live in, then you, like the medical power of attorney, have a higher level of responsibility in legally responsible roles. If you're the guardian or conservator, you are the ultimate decision maker. If you are the power of attorney, you can be the ultimate decision maker if your parent doesn't have the ability or the capacity to make those decisions. Fiduciary responsibility, it's an obligation to act on behalf of the person, an elderly parent. It is a standard of the highest care. Let me repeat that, standard of the highest care. That means that you can't take this lightly. This is a serious responsibility, and many family members do not realize that. It's also important that no conflicts of interest exist. We talked about in the prior section of legal planning about conflict of interest for medical and financial power of attorney. It's not providing medical care, it's spending money unwisely, not on a parent's care. When an adult child is appointed, a conflict of interest means placing the adult child's interest or the interest of someone else above the needs of the elderly parent. Being a power of attorney, being a guardian or conservator, it's all about the care, all about the desires of your elderly parent, has nothing to do with you. Some people in these roles have very great degrees of difficulty separating their emotions from what their parents wanted. My mother and my father appointed myself and my brother in legally responsible roles because I have a sister who is a nurse. They knew that she would never ever turn off life-sustaining machines, which they specifically did not want. My parents were smart enough not to put her in that decision-making role. They put my brother first. He made the right decisions. He followed their directions. Both of my parents were on life support at the end of their life. That life support was turned off because they had the legal documents that said what they wanted. So, for example, if there is a child who is financially reliant on your parents, the logical response would be that that person should never be appointed the financial power of attorney because of the potential for financial abuse. If a child needs your parents' money, who are they going to spend it on? Themselves or your parent? That is not a decision you want to leave to chance. The same goes for medical power of attorney. A conflict of interest can exist if money is not spent on a parent's care, if the care is not designed in a way to support the parents. So poor care, neglect can result for the parent. Accepting that, a person is not doing the right thing can be hard within a family. It can be hard to judge a brother or sister, but the appointments shouldn't be taken lightly, and appointing the person, so choosing that person, should not be taken lightly. And when care is extensive, being in those roles can be like a full-time job. It can be very, very time-consuming. So we have another story. This is a story of conflict of interest within a family. So family situation, married couple, 2 sons. One son is an attorney, not related to elder law. The other son is a policeman. The father, jovial, lovely person, has a stroke. He needs extensive care. Because of being immobile and his wife not being able to lift him and all of that, the decision was made to put him in a nursing home. He could have stayed home with 24-hour care. There was enough money. There was plenty of money to do that, but that was not the choice. So he went into a nursing home and was there for about a year until he passed away. So he passed away. Mom lived for, a few years after that, before she started to get health issues. And mom was kind of a difficult person. The sons favored dad, who was just a lovely person. I knew him. Mom was a little difficult. She could be a little demanding. She probably had some issues that dad hid from the kids all those years because of her demanding personality. And they would say to me, "Oh my God, I don't know how my dad lived with her." Or, "Boy, dad really had that under control before we got involved." So I don't want to say they were not fond of their mother, but they probably didn't dote on her as much as they did their father. So mom starts to have health issues, could have stayed home with 24-hour care, didn't. They moved her into an assisted living community. She started to express concerns about heart issues and panic attacks and not feeling well. They did take her to a doctor a few times, but then toward the end, they got tired. They got tired of the calls of, "I'm not feeling well, I think I need to go to the doctor," all of that. Guess what happened? Mom had a stroke and died. At the end of all of that, there were millions of dollars left in a bank account. Do you know who inherited the money? The 2 sons. Both of those parents, if they would have assigned oversight, if they would have thought more thoroughly about how to draft those power of attorney documents and their living wills, could have assigned someone to provide oversight to make sure that if there was money, they could have received care in their home, 24-hour care in their home, for as long as they wanted and as long as they needed. My belief is that if your parents earn the money, it should be spent on their care, not preserved for inheritances, not preserved for sons or daughters inheriting money that could have benefited the care of elderly parents. So, lesson for you in doing your estate planning documents, for you in talking to your parents about their documents, and making sure that there's oversight for whoever is appointed. Let me advance the slide, take myself off camera. We will continue. So let's talk about the importance of familiarity with medical conditions. And this really is up to you as the caregiver and up to your elderly parents. The importance of becoming familiar with an elderly parent's diagnosis, all of them, is essential to being the best advocate possible, the best power of attorney, guardian, conservator. The caregiver for an elderly parent with any type of dementia becomes the eyes, the ears, the advocate, and the decision maker. Same for the power of attorney. Eyes, ears, advocate, decision maker. It's difficult to make good decisions if you're not familiar with all aspects of a loved one's health, past, present. Making good decisions means that you have a detailed discussion about health diagnosis, prescriptions, allergies, past surgeries, what your elderly parent wants for care. I know I repeat this, it's very important. Because at the point when they can't communicate, you cannot get this information from them. It is too late. As a family member appointed to be the power of attorney, it's your responsibility to understand the importance of this role that you are taking in advocating for your elderly parent. Take an early interest in health, in your parents' health. Because I served as a professional fiduciary, guardian, conservator, medical power of attorney, financial power of attorney, personal rep trustee, I have a very different view of the responsibilities of these roles. Power of attorney, all of these should be a partnership where you and an elderly parent work together in the very early stages when health begins to change, when there are early diagnoses that you can help your parent understand the consequences, understand of changing their actions, understand the consequences of not changing their actions. Understand this for yourself. It can be time consuming, but it benefits both of you. You see your future in your parent. You see the diagnosis, you see what they can do, you're learning about it. You can translate that to yourself and translate that to your children who may become your caregivers if you have children. There's a gap that happens most of the time when power of attorney documents are drafted because they're usually put in a file cabinet somewhere or in a safety deposit box. They stay there until somebody's dying, and then all of a sudden, these documents show up. There are times even, believe it or not, when the person appointed didn't even know that they were appointed. They weren't even asked if they could serve as power of attorney. Sometimes they say no. If there's no provision for a successor, that is a problem. The person who is the power of attorney is a support mechanism. They are a support mechanism for the care and the well-being of that person. Ongoing conversations about health, well-being, money should happen. Involvement should begin while health is relatively stable, before money issues happen. Early involvement allows you to learn about everything that you should, so that when decisions have to be made, there's no confusion, there's no disagreement within the family. Acting in the role of power of attorney requires taking an interest in health and well-being, which benefits your parent and yourself. It supports better care, better decision-making in the short and the long term. Being interested means that you're making an effort. You're making an effort to learn, to ask questions, to learn about everything that you need to take care of your parent. You learn about medical diagnosis, future consequences, pros and cons of medications. You know what the diagnosis means. You know the background of everything. You're on a first name basis with the pharmacy person, the doctor's office, the nurse in the doctor's office, people who are taking care of your parents. You are that person who serves as the advocate and who asks questions for the care needs of your elderly parent. Patient education and patient advocacy is so important. Can't emphasize it enough. I know that everything seems to be important, but this is very, very important. Becoming an educated and proactive advocate is the way to get better than average care for elderly parents. Instead of trusting the healthcare system to do the right thing, you cannot do that. We as the caregiver and the medical power of attorney and the advocate must do the right thing to become educated and to advocate. The healthcare system operates on an acute care approach. Let me explain that. An acute care approach means that they provide treatment for severe or life-threatening injuries or illness. In simple terms, that means any reason that you might go to the hospital emergency room. They are only treating you for that reason. Hospitalizations, they're traumatic for an elderly parent with dementia. Never send your parent there alone. It's scary, they can't communicate, errors happen. Discharges, meaning sending the patient who is your elderly parent home. They want to get your parent out of that hospital as rapidly as possible. They don't want to admit them. They want to keep them on observation. They get penalized. So hospitals are penalized for people over age 65 coming back for certain conditions, hip fractures, knee replacements, cardiovascular issues, pneumonia. Something to ask about when your elderly parent goes to the hospital. So while an elderly parent can be medically stable, and that's the term that the hospital uses for discharge. So it's your responsibility to ask and understand the short and long-term impacts of the hospitalization, the treatments, and the care issues, because there are short and long-term impacts. Let's talk about medically stable for a minute. You see the guy in this slide just putting his hands on his head because he's like, I don't know what I'm going to do. Medically stable is a medical term that means acute or urgent need. And it means that whatever that was, the heart attack episode, it's manageable, it's past. Elderly parent doesn't need to go to rehab, they're discharged home. You're told, go see the primary care physician, work out the rest of the problem. For families, though, medically stable may not necessarily mean that. An elderly parent can take care of him or herself at home. There's a gap in the perception of care needs that result in stress for family caregivers who are either trying to arrange additional help, figure out how they're going to care for a parent who is discharged from the hospital who cannot care for him or herself. It happens a lot. When the caregiver is involved, when the power of attorney is involved, and actively managing those health concerns. All of the errors that include your parent going home, immediately going back to the hospital, not managing those healthcare issues, having higher healthcare expenses, all those issues, they can be managed if you are more active, if you ask questions, if you be proactive. Let's talk about care conversations. So these hospitalizations, these acute care situations, these again are the reasons that elderly parents and caregivers must talk about what ifs, about real life situations that include the health, the well-being, the career of the caregiver. Can you take time off work to help a parent? Can you not? What family relationships exist? Being healthy is not about one little aspect of our life because it touches everything else. Being healthy affects how we think, how we work every day, how we feel, our ability to earn income, our relationships with our family members. It's a life transition. It's a life subject. Monitoring, maintaining, and creating care-forward thinking, care-forward environments, they take education and they take advocacy. Elderly parents and family caregivers will devote significant time, if you want better than average care, to caregiving and to managing health concerns. If you really don't care, you don't have to do any of this. There then will be consequences that will be uncomfortable. You will have constant crises, constant unexpected situations, not really a place that anyone wants to be, but you've got to be proactive. It does take time. It does take work. Learning to manage and stabilize health conditions will result in situations that are less stressful, are less chaotic. Avoiding healthcare bias, it takes additional steps to create situations and a living environment where you're focusing on independence and quality of life and being proactive about health, not being ignored by a healthcare system that can be insensitive. So why getting good care can be difficult? There are so many reasons. Frustration results when caregivers and elderly parents are swept into the healthcare system that seems to control your ability to receive treatment, seems to control your insurance information. You can feel like you're powerless. Doctors can seem very rushed, disinterested. Insurance companies may be very slow to approve treatment, prescriptions, things that your parents need. It can be a scary situation when you feel like everything is out of your control. Then on the other hand, a lot of individuals hesitate and they're afraid of working with the healthcare system because the healthcare system does seem to control everything. The healthcare system can be impersonal, can be uncaring, bad customer service, providers are rushed for time. You've got long waits for treatment. It's, the customer service issues that happen in normal life with other things are even more visible in the healthcare system when you're concerned about a loved one and when you're trying to get care. So let's talk about challenges to getting good care. Some elderly adults and patients become very frustrated and they want to give up. My recommendation to you is never give up. It will take definitely more time, more effort on your part to get the care that you need, but don't give up. So I put education on here because we have to seek out education about health. It just doesn't show up on our doorstep. Physicians don't talk to us about prevention. I've talked about that multiple times. We have to be the ones to seek out education about health. Being employed can be an issue because if you're the caregiver, are you worried about having to take time off, coming in late, leaving early, having to take a leave of absence? Being an employed and working caregiver is stressful. If you're here, it's possible that your workplace is supporting this program for you. That is wonderful because the statistics about working caregiving stress in the workplace are significant. 30% of caregivers leave to go take care of a loved one. Caregivers worry about job discrimination because of having to take time off to care for loved ones. It's a huge concern. So that relates to being concerned about job security. A lot of caregivers worry about, oh my gosh, am I going to get fired if I do this? Having transportation is another issue, not only transportation for the caregiver, but let's say your elderly parent lives at home and they don't drive. How do they get to doctor's appointments? What if the doctor is all the way across town? Can they afford a taxi? Do you have to take them? Transportation becomes a big concern when elderly parents who don't drive anymore need help, or even if they do drive and they use a walker, how do they get around? Lacking understanding of medical conditions and terminology, that relates to education. As a caregiver, as an elderly adult, we have to ask questions until we understand. So very important. Written instructions are helpful. If you don't have good recall of the follow-ups from a doctor appointment, or you get confused, or you're not sure what you're supposed to do, ask for written instructions. That eliminates the possibility of error. It ensures that you are more likely to follow through. And elderly parents who need help from family caregivers, again, it's that idea of being dependent on someone else to get you to doctor appointments, help with your medical care, get prescriptions. It is the role and responsibility if you are the power of attorney. More challenges. Safe home environment. Stairs, double railings, safety equipment in the bathroom, one of those 911 buttons, I've fallen and I can't get up. It's important to create a safe home environment to avoid accidents that can be prevented. Being literate in medical speak. So I've used medical speak terms throughout these presentations. ADLs, IADLs, POA, all of those. If you don't understand what the doctor's talking about, ask. Do not feel silly. Have the confidence to ask questions. Be confident to advocate for care. Do not be afraid. Consumers who work, patients who work, elderly parents who become involved in the healthcare system do struggle with getting good care. One or more of these issues that we've talked about increase the difficulty of asking questions, advocating for better care. For these reasons, being proactive, not being afraid to ask questions, seeking education, being persistent to a fault. Never give up. It's necessary to get the care for your elderly parents, especially if they're diagnosed with memory loss or they have a lot of chronic conditions. So the summary: patient and caregiver education, in addition to becoming an advocate and an engaged caregiver and patient, invaluable. This is the only way that you will get good care. In the care process, knowing medical diagnosis, terms, treatments can all be confusing. It's your job to be the expert. Ask questions until you fully understand the consequences of the decisions. And then ask this one: what should I be asking you that I am not? What else should I know? Those questions of what should I be asking were questions that I taught my staff over a period of years. I had care managers who worked for me when I was the guardian or the power of attorney. And they would come to me and throw a situation on my desk, and I would say, well, what question should you be asking? What didn't you ask that led to that problem? The idea in being an advocate is to try to anticipate things that go wrong so that when you work through a situation, you address as many things that can possibly go wrong so that there are no unexpected situations, so that the care of your parent is good. Now, honestly, you'll never be able to address 100% of them because there are crazy things that come up, like medical errors, or somebody on the other end didn't check what they were doing. It's your job to manage the situation, to oversee the care, to try to make sure that everything that you want to happen happens for your elderly parent, to be the best advocate that you can. I can help you do that through these webinars. I know that you can do it if you put in the effort. I'm Pamela D Wilson, caregiving expert and advocate. Thank you for joining me for patient education, patient advocacy. I'll see you in the next webinar.